Good morning, everyone. Dr. Christine Smith back for a wonderful interview today with Dr. Anna Cabeca, who is a OBGYN specializing in hormones and intimacy and understanding things like perimenopause and menopause and still being able to have intimacy in your life. And she has her own story of healing as a practitioner. It's like this, I think, is always fantastic to have on and to speak and to share their journey, because I think a lot of people end up feeling alone in their healing journey, and it's incredibly important to feel connected, which is one of the other reasons I wanted to bring her on, is because she's basically a specialist in connection and connecting with other people and connecting with your partner, connecting in intimacy. I was just kind of telling everybody a little bit about you, but I'd also love if you could just share a bit about yourself and how you fell in love with this niche of really understanding hormones and intimacy and helping people feel connected.
There's a saying that says your mess becomes your message.
Yeah.
And that's certainly true for me. I don't know if any listeners can relate to that, but you kind of learn what you need to for yourself. And that's certainly true with me. I trained as an OBGYN, have been always passionate about women's health and the disparities in women's health and men's health, right? And most of the research done has been done on men and then just extrapolated for women. And we are not just hairless men. So we are not that. So I think that was a really, especially in cardiovascular disease and hormone health and aging, women get the short end of the stick, so to speak. And so I've been passionate about that, and part of research, including an arm of the HERS trial, which was the hormone replacement study and looking at heart disease that was done in the late 1990s. So been passionate about that. And then my own mess with diagnosis at age 39 of infertility and early menopause. And then realizing when my doctor's bag was completely empty and my colleagues were like, hey, we're sorry, and here's an antidepressant, and maybe you can try egg donation. And that journey around the world, and the grace of God helped me reverse early menopause and naturally conceive a child at 41 years old, the child I was told I would never be able to, conceive or to have. She's 16 as of yesterday. And I've learned so much in this journey. I've learned to recover from trauma. I've learned the effect of our hormones on our physiology, and our physiology on our behavior, and how to be empowered and feel empowered certainly in the second spring of our life, but at any age. And I do, it's really a passion to see people turn their lives around based on what they're doing, and not a prescription pad or surgical procedure, when necessary, right?
Well, I think that's such a powerful thing to hear from an OB. So thank you so much for sharing that with people and helping them understand how much personal power we have internally, and that in our conventional system, we're often given black and white answers, which aren't necessarily true, and that our body is incredibly capable of adapting to our life if we listen to it in the right way. So I would love to dive a little bit more into some of those topics. I know you had even mentioned just kind of like the safety of like hormones and hormone replacement therapy. I know that's a topic that confuses people sometimes. So if you want to share any of your thoughts around that, I'd love to hear them. And then just kind of talking about this hormone symphony that happens in our bodies, because it's like both men and women have estrogen and testosterone, and we also deal with other hormones like progesterone, and then we deal with upstream things like DHEA, and it's kind of this blend of things. And I'm sure we could talk about that in depth, but yeah, I'd love to hear your thoughts in those areas.
Yeah, well, definitely we look at hormone replacement therapy and the difference between what's bioidentical versus, or body identical, depending on what terminology you're using, bio or body identical versus synthetic, not chemically identical to what our body produces naturally. And so we know that in the Women's Health Initiative trial that was halted in 2002, they were using hormones that they were giving to women that, first of all, pregnant mare's urine, so Premarin, it's over 30 different estrogens, not identical to what we're producing. And then oral estrogens increase inflammation and stroke. We've seen that. We saw that in the HERS trial. We saw it again in Women's Health Initiative. And then we used Provera. Provera is a synthetic progestin that actually can cause weight gain, can increase the risk of heart disease, and we saw again it increases the risk of breast cancer. So to use Premarin and Provera today just seems absurd based on healthier options that we have both in the pharmaceutical and through compounded pharmaceuticals. So I kind of get irritated about that a little bit. And there are better progestins when we have to use a synthetic progestin, but I rarely, if ever, I can't even think the last time I needed to. I use bioidentical progesterone, either oral or in topical forms, and get great results. So that's, what has been our standard pharmaceutical drug cabinet approach. And yet there's the art of medicine, which when physicians take time to learn it, to compound, to customize hormones, it really can make a big difference. And the safety, the bioidentical progesterone studied in over 100,000 people by Dr. Fournier through 2010 had shown no increased risk of breast cancer with bioidentical progesterone, oral or topical, but they'd studied oral compared to oral synthetic progestins, which did show a significant increase with Provera, yet again being the worst among them. So So it can be very safe. And I had a breast cancer patient in my office yesterday, and I always look at every patient. How do we create bodies that are inhospitable to cancer, right? How do we create optimal, functioning, healthy bodies? And especially if you've had a history of breast cancer. And this patient, 70 years old, she was like, she came to see me like a few months ago, and she had aches and pains, wasn't active anymore, was struggling, and had a history of stage 1 breast cancer that was diagnosed several years ago. And so she since is now empowered, and she lost some weight, but more importantly, she's running 5 miles again. So at 70 years old, and she feels like she has a new lease of life. She has a libido back, and she feels energized. And so like that's a body inhospitable to cancer. I see her and I'm like, please share your story. Please inspire others. And yeah, it's very powerful.
Those stories are incredibly powerful. And when you realize like what changes you can make even at your later years in life, I think people underestimate themselves in that sense. So thank you. I love that. Thank you for sharing all of the research on that, because yeah, it's confusing for people. So just if we were going to like summarize and recap that, if someone were looking for these things, so let's maybe comment on like what to look for that you would approve of if someone is curious about these things, or how to reach out to you if they have any questions. And then diving into, maybe we can discuss a bit of like what you see in your clients, and we can discuss the physiology of like the classic kind of hormone cascade, and then when things start to change, and then where you tend to intervene with clients to help preventatively so that they don't end up in a tougher situation down the road.
Yeah, so I mean, it's a great, it's such a complex area. So at my website at dranna.com, so dranna.com, you will see a wealth of information. I've done hormone master classes. I have a hormone master class coming up. So, be sure, Mastering Your Hormones masterclass. So be sure to sign up for that at my website, or email my team, and they will get you all the information. I forget what the website is, but I think it's dranna.com masterclass or hormone masterclass. I'm not sure, but just comment below and we'll get you that information. And so, because it is complex, when we look at the hormonal hierarchy, like you mentioned, the estrogen, testosterone, those are downstream. And then up from that is DHEA. And then up from that is progesterone and pregnenolone. And all derived from cholesterol. So these are really important. And that's how I studied. I mean, Christine, you know, in school, like I studied the pathways, the metabolic pathways, the enzymes, the rate limiting steps. And when it comes down to it, what we didn't talk about was the power of cortisol and insulin affecting all those hormones. And then the most powerful hormone being oxytocin. And as OBs, we know oxytocin because we inject it in a mama to make her labor come faster. It's excreted in abundance in pregnancy and childbirth and during orgasm and intimacy and laughter, the ways we increase our own oxytocin naturally. And so that is the most powerful hormone of our body. And I've realized that through my own journey. And then when I was in the abyss and I felt disconnected and I was depressed and I was suicidal and I was, you know, just devastated in grief. And when I was all those things, realizing that, you know, what's happening to me, I love my husband, but I don't feel love for him. I love my work, but I'm completely burnt out. I can't bear to go in another day. That's where physiology is affecting our behavior. And that's what I call the war between cortisol and oxytocin.
I don't think oxytocin is talked about enough. And I want to just kind of recap what you're saying for anyone where this is like newer information for them. So one of the things she mentioned that I also think is not talked about enough is cholesterol's role in our hormones. And we have such a focus on having low cholesterol, when really, if we want to protect ourselves cardiovascularly, we should be asking, why is the cholesterol high? It usually means that we're trying to repair something in our body. We should be looking at inflammation of the blood vessels and our ability to process debris in the body through things like homocysteine. And then we can come back to our cholesterol because all of our hormones, our stress hormones, our sex hormones, they're all made from cholesterol. So if our cholesterol is too low, it is actually really hard to make our sex hormones properly. Or if our stress is too high and it is using all the building blocks of cholesterol, we are going to pull from our sex hormones and not prioritize those as much. Because if we think evolutionarily, if you're stressed because you're running from a tiger, your body is going to prioritize that stress over reproduction in that moment. It's just now our tigers are bills and worrying about that thing in the future and thinking about that thing in the past. And so if we can start to educate people on thinking about these things like, I'm really low in my libido right now. I wonder if I'm more stressed out than I think. Or I wonder if I had some kind of interesting toxin exposure. Or I wonder if I'm really inflamed from something that I consumed and my stress response is adapting to that and it's actually pulling from my reproductive hormones. So I just wanted to give people a little bit of that structure of how they're all interconnected. But what makes you say that oxytocin is the most important? Like, I'd love if you could educate people a bit more about it, because like you said, most people just think of it as like the labor hormone or like the intimacy hormone, but there's so many other ways that it takes part in our life.
Oh my gosh, I want to go into it, but I do want to highlight what you said about cholesterol. It's so important. There was a study done in Italy looking at men on cholesterol medications, and ones that had their, you know, were on statins, and as their cholesterol was lowered, so was their testosterone, which makes sense. You take away the building blocks, you empty the bucket, there's no testosterone. And then, you know, I mean, it's just like a screwed up system. And the other thing is, why was the cholesterol high in the first place? That is always the number one question you have to ask when I see, I ask when I see someone with high cholesterol, what's going on? Well, maybe it's genetic, maybe it's heavy metal poisoning. Do you have a mouthful of amalgams? What's going on? Maybe it's hypothyroid, then what's going on there? Is it endocrine disruptors? I mean, we have to ask, why is the cholesterol high to begin with? Before we just lower it and take away a protective layer of our, you know, of our nervous system. So that's first thing.
That's the other one that I didn't mention, right? Is that cholesterol is also used to make your myelin sheathing, which is the encapsulation of your nerves so that they can conduct properly. So if you're continually lowering your cholesterol, which is also a neural repair mechanism, a cellular repair mechanism, all of a sudden you can't repair your cells anymore. So yeah. Thanks for mentioning that one.
Oh, and let me just, because this is what we get passionate about when we're together, you guys. When Christine and I together, and we spent New Year's Eve together, we had such a great time. And so, but you know, it's like that passion, our health span, we want our health span to equal our lifespan. Every day that God gives us to live on this earth, we want to live it with purpose and passion and quality, and I want you to too. And so play, we laugh, we have fun, and want to have the ability to do this. At 90, I want to be naughty. So I want to continue to be naughty. I want to be like riding a horse with my daughters and granddaughters and great grandchildren. In order to do that at 90, what I have to do now at 57 is make sure I'm horseback riding, make sure I'm strengthening my legs. I was doing my workout this morning, as much as I hate to work out, but I do it because at 90, I want to still be doing it. So anyway, that's the passion behind us. So if you agree, give us a heart.
Yeah, absolutely. Well, I always like to say anything you do every day, you can do every day, right? So just keep doing those things every day.
Oh, that's
So let's come back to oxytocin a little bit. You said that you think it is one of the most important hormones in the body. How do you see it interplaying with these other ones?
So it is the master hormone. So I like to talk about like our body of hormones and think about a body of a university or a school setting. And if we think of all the students at a school are, intelligent, have a driven role, a unique purpose, a unique path. That's like all the different hormones in our body. Each one of them has its own roles and responsibility and purpose and drive. Now, then you have professors at the university. So those are your teachers, those are your instructors. And if your instructor is absent all the time or high or drunk, there's going to be chaos among the kids in the classroom. I don't know if you ever noticed that, but I definitely had some professors like that. And then you have the dean or the president of the university. If the president of the university is like out, philandering or whatever he's doing or she's doing and isn't supporting the teachers or supporting the university setting, there's chaos. Well, oxytocin is the president of the university. And the professors are insulin, cortisol, and adrenaline. And all the rest of the hormones are reproductive hormones and vitamin D and melatonin and all these other really important hormones. But they're really influenced by adrenaline, insulin, and cortisol, and then overarching oxytocin. And you asked about the research. I'm using oxytocin in my long COVID patients. I'm using oxytocin to help support PTSD and trauma and excessive grief and burnout, and as well as encouraging our body's natural ability on a daily. I wouldn't be here without the practices that I use as a priority in my life to make more oxytocin. So the practices of gratitude, like Benazati always says, vitamin G, the vitamin of gratitude. Gratitude is huge, and it increases oxytocin. The practice of being in the present moment, the practice on laughing more and finding things to laugh about, even in some of the really dark moments. And then and of course, being out with the horses, doing things that you enjoy so that you can increase oxytocin. But research has showed even in aged muscle, oxytocin repairs. It's also what, through the practice of increasing oxytocin over cortisol, it's the most alkalinizing hormone in our body. I mean, you can be eating like shit, but have a great night out with friends, a lot of laughter and really support the alkalinization of your body. So versus cortisol, which is the most acidifying. And I like to tell people, Christine, like you can live in the direction of oxytocin or in the direction of cortisol. You get that choice. Every thought you make, every step you take, you have a choice. Am I moving towards oxytocin or am I moving towards cortisol? Am I moving towards love or am I moving towards fear? Am I moving towards gratitude? Am I moving towards greed? Am I moving towards health or unhealthy? I mean, it's a choice. Where do we want to be? We want to be on the oxytocin side of things. And so, yeah.
I love that. And I think there's so many different ways to cultivate that in your life. And I love what you said about perception and that it's very much about how you are perceiving things. So working with a practitioner like Dr. Anna, like as you're going through hormone changes in your life, because, we have our cycles and then usually somewhere around mid 30s to even 50, like it can really range for people, we start to have a decline in hormones. And then that's kind of the perimenopause era, which is, it can be like 10 years. And if we are perceiving it as something negative or that, we're becoming less worthy or we're really disappointed in our body, it really shifts the change, and it can make the hormone shift much more dramatic because we're in a stress state. So if you're
Absolutely.
working in a supported form with someone like Dr. Cabeca, then you have this positive view and you can actually feel more connected to your body in accepting it as it shifts and changes. And I think everything that you're talking about, like, I'd love if we could, you just mentioned a few of them, but other ways, because I know you work with lifestyle and functional medicine in your practice a lot, and just teaching people how they can regulate their hormones using lifestyle factors. Because I know, like, we've also attended a meditation conference together. Meditation is a huge way to affect your hormones, and that's shown all over the research. But like, one of my next questions for you was, what do you wish people knew about their hormones? And I know for me, it's I wish they knew how many natural ways they can affect them, simply as much as changing their perception, which is where meditation comes in, right? It's like meditation is really an opportunity to go inward and let your body feel safe. That can come in a million different forms of how you're doing it. But in that safety, that is where our body starts to self-regulate and starts to produce repair mechanisms, which is where we really tend to balance out versus degradation. So yeah, I'd love if you could talk about some of the lifestyle things that you teach people in your practice and just what you wish they knew about their hormones.
Yeah. Well, like exactly what you're saying, it takes more than hormones to fix our hormones.
Yes.
And these lifestyle things these lifestyle factors are key. And after I spent, the key, decades of my reproductive life and hundreds of thousands of dollars on my medical education, I realized when my hormones were still dialed in on paper, I didn't have the insulin and cortisol and oxytocin under control because I was in PTSD. I was in huge trauma and burnout. And so it wasn't until I realized that's what I needed to do and for me, it's the keto-green lifestyle, because again, you're just filling your bucket with this. You're filling your bucket with your body's natural ability to make its own hormones, and also at the same time sealing the holes in the bottom of your bucket. So you're filling and sealing, and that's key. That's what lifestyle does. And things like you said, like with meditation. And my 70-year-old, she's been doing now the Joe Dispenza Breaking the Habit of Being Yourself. It's on my list of recommended books, like along with mine, but along with my list of recommended books for people to break the habit of being yourself, to get out of the habits that no longer serve us and to adopt the ones that do, like when we're meditating. And also focusing on sleep and focusing on laughter and kindness and gratitude, even in the shittiest of circumstances. There's something to be grateful for. And I say this from being in a place of severe devastation at one time in my life, if not more. And so these are practices. And so it takes more than hormones to fix our hormones. In the keto-green way that I teach, it's about lifestyle, and it's about creating insulin sensitivity. And it's about addressing cortisol and decreasing the acidifying nature of cortisol on our body. So it's a lifestyle, and of course movement.
And I talk to people a lot about, like, for cortisol and what I call like our rhythm, right? Like our body rhythm. Simple things like moving in the morning in that like sunrise type of sunlight, and then in the evening, moving in the evening at that sunset type of sunlight. That light without sunglasses actually starts to regulate your cortisol and regulate your hormones anyway. And as we regulate our cortisol, which is our stress response that we were talking about, we start to regulate everything else, because as I mentioned, cortisol is kind of a thing your body will prioritize. So if we're not prioritizing it, we have more resources for other things. And when you think evolutionarily, like, we're meant to be like sitting by the river with our tribe, enjoying our latest catch and like relaxing. Our society isn't super conducive to that anymore. So we operate with much higher level of cortisol than we used to. And so now that's why having these practices like mindfulness, or, a really regular exercise routine, or something where you're checking out of the rat race pace of our society and coming back to that like tribal type of pace and being centered in yourself, that is how we rebalance. And that's why grounding in nature are like even more important now than they ever were. So just like those easy concepts for self-regulation and things like that. And I see you smiling, so add any thoughts to that you want.
I'm thinking how self-regulation is not drinking coffee in the morning and taking melatonin at night. That is not self-regulation. I think about it because that's sometimes how we function, and like self-regulation is working with your body's natural circadian rhythm. Otherwise, it gets so screwed up. I look at circadian rhythms all day with my patients and my clients and with referrals. So I look at these circadian pathways and they can be all over the place. But the most worrisome are when they're flatline low. And that's when you're like struggling. You don't even as many hours as you sleep, you never feel rested. You're exhausted. You're gaining weight without doing anything different. And you're living in shades of gray instead of multicolor, rainbows. And it's a different type of life. And I get that. And so working with your circadian rhythm, we're continuing to learn about it. Like our metabolic, certain peptides for our metabolism and genes are on a clock basis. And most of them, most of them are, higher between 10 and 12, which is typically when you're supposed to be eating, 10 a.m. to 12 p.m. noon. There's 5 different genes that are more elevated during that time to help with metabolism and food and energy production. So that's also the same time when we see, we have our cortisol in the morning and then it will start to go down. So we have to honor our circadian pathways when we're creating our lifestyle, and so that it's not just okay, let me drink all the coffee, let me drink all our danger coffee, thank you Dave, or let me drink, and then at night melatonin and all these other things that we're trying to do. We may need them to help support us, but it's better to create that naturally. And what people don't realize is that as we're aging in the mid 30s, 40s, 50s, sleep will be disrupted because we have less progesterone keeping tryptophan active, and tryptophan is needed to make 5-hydroxytryptophan, which goes on to make serotonin. And as we have less estrogen, we have less serotonin available, and guess what? That makes less melatonin then, and melatonin is our sleep hormone. So we want to work on things that are going to increase our body's serotonin, our tryptophan, our higher up our progesterone levels. And I know you do too, but like I use adaptogens in that. I use my product MightyMaca Plus as a standalone to help with our body's natural restorative hormones. But that melatonin is needed to make oxytocin. So we got to have that oxytocin in there. And so, you think about, sex, it's kind of, I kind of wonder, well, why, melatonin peaks at night? Is that why you feel more, you want more lovemaking at night or better orgasms at night? Or what is it? I mean, it's good all during the day too, don't get me wrong. But just wondering with that spike in melatonin, if that increases our spike in oxytocin and orgasm. Anyway, yes, it's okay, Mary, to use melatonin. I use it a lot with my clients. I highly recommend it, and especially, again, wanting to address the underlying issues why melatonin is low, and it's a potent antioxidant. So, yeah.
What is your opinion around, so like I will use melatonin with people sometimes as well, but I also try to keep it at a fairly low dose. And if they are able to not use it, I encourage them to skip it sometimes. But it can also be really helpful if you're like feeling under the weather, because it also has effects on our immune system. So timing of it can also make a difference. But I try to encourage people to go low, and if you don't need it, not using it type of thing, so your body doesn't become dependent. But what are your thoughts around that? And then I also saw another question. Someone asked, how do you administer the oxytocin?
Okay, so first with the melatonin, melatonin's great. I like a sublingual 3 milligram. Start with half of it, 1.5 milligrams. Now I do have some cancer patients I have on 20 milligrams. And so, really want to look, but I don't want to suppress or do anything to down-regulate your body's natural ability to increase oxytocin naturally. So, increase melatonin naturally or affect your circadian rhythm. I want to work with it, not against it. So sometimes, and Christine, we're gonna have to do this sometime, is just like, I'll prescribe like go camping for 3 or 4 days. I mean, that is such a huge reset. Going to sleep with the sunset, sitting at a fire, talking, and hiking and being in nature, grounding your body's energy. I mean, that is like, there's very few things better that I can write on a prescription pad than that.
Unplugging as hormone therapy, hormone replacement therapy. I like that. That's a great one.
Yes.
Beautiful. And then for the oxytocin, yeah, how do you usually administer that for anyone who's curious?
So there are different ways too, and I write about this in my book, The Hormone Fix, and I talk about natural ways to increase oxytocin as well as foods that increase oxytocin. I talk about those in Keto-Green 16 too, my second book. So there are ways naturally to increase it. Again, the practice of gratitude, being generous with your time, tithing, and talents. These are things, prayer practice, meditation practice, all increase oxytocin. Puppies, animals, for sure. Horses increase oxytocin that you love, things you love and enjoy. I'll often write a movie therapy like My Big Fat Greek Wedding. Definitely increases oxytocin. So these are things that you can do. When I prescribe it for a patient, I may use a troche or a nasal spray, so a lozenge essentially. These are prescription, working with a qualified compounding pharmacy that knows how to prepare oxytocin. Not all do. And so whether I'm using nasal spray or a lozenge type that I can also use vaginally if I'm using it for sexual health and function, when we use it as OBs, as obstetricians, we inject it in we'll inject it either IM, but typically IV drip, we use it IV. And so, so those are ways that we'll prescribe it medicinally. And there's I have a whole process before I will prescribe. I have a whole questionnaire. I may do testing. I may do a test injection of oxytocin or a test supplement of oxytocin and see how my clients do. Because again, it's the most powerful hormone in our body. I want to encourage your body to make it. But sometimes we need to support around it.
No, I love that. Thank you for sharing that for anyone who is curious. And so basically there's a lot of options. I also just want to remind people, none of this is medical advice. We're just educating you about questions that you can ask your practitioner. So please always ask your practitioner what's right for you, or feel free to reach out to Dr. Cabeca and have a chat with her. But I know you also have another podcast coming up, so I want to honor your time. As we kind of wind down, I wanted to also ask, what's one of your favorite things that you've learned recently, because I know you're always learning, about this subject area that you think would be cool for people to know?
Oh, well, I think, my really a favorite thing that I've learned recently is that, oxytocin, being able to use that and use the practices of increasing your oxytocin naturally and for the immune system, for our long haul COVID, for our autoimmune disease patients, and really focusing on that in these clients as well, and looking at the research to support it, which again, happy people are healthy people, and that's oxytocin.
Yep. So that's kind of a big concept. I just wanted to pull it out in case anybody didn't hear it. She is using it for clients struggling with long viral symptoms. So actually being happy can lower your inflammation, and being stressed out can raise your inflammation from a number of different ways, which even like a lot of people don't know that if you're really stressed out, it can actually grow bad bacteria in your gut, and it gives you a little bit of leaky gut. And if you're dealing with leaky gut, then you're dealing with a bunch more inflammation, which goes back and affects your hormones a bunch more, affects your liver and its ability to process your hormones. Any other tips around like the other systems of the body that you want people to know, just that you think is really important for hormones?
Yeah, I think that what happens too in perimenopause is that our body goes from its ability to use glucose for fuel is less optimal. And so shifting periodically into using ketones for fuel is going from gasoline to jet fuel. So
I love that. And for anybody who's curious, feel free to explore either of our web pages. And there's a lot of different information, because there's different ways to fast, and there's different ways to listen to your body or to induce ketosis. And I am a fan of kind of going in and out of it. I think that's a little bit more of an evolutionary approach, and I tend to be more on that evolutionary biology side of things. So if you think about like the rhythm of our life back in the day, it's like we'd go for a little while without having a lot of food or a lot of game, and then all of a sudden we'd get a whole bunch of food and we'd consume it for a little while, and then we go back to not having a ton of it. So it's kind of that like in and out of things. Any other things that you kind of want people to know?
Just, to ask me anything. I'm really happy to be here and gave a lot of information today. And it's important, the hormone hierarchy, the fact about, keto-green, keto-alkaline, and really focusing on your physiology of your major hormones and being careful not to do anything that's going to deplete your own body's ability to make hormones naturally. And come visit me at dranna.com. And my book, The Hormone Fix, it's one of the mandatory reads for my patients. So definitely start there, and keep an eye out for my hormone masterclass coming up.
Perfect. Yeah. And if they wanted to check that out, is just following you on Instagram or going to your webpage the best place?
Yeah, definitely sign up at the webpage at dranna.com.
Perfect. This is one last good question if you have just a minute. So what foods are best during these hormone fluctuations? So like, I always love food as medicine. Let's just end with that one really quick and then we'll sign off.
Absolutely. And I've written 3 books on this. So The Hormone Fix, Keto-Green 16, and MenuPause. So you'll definitely love those. But cruciferous vegetables for estrogen detoxification, fermented food for gut diversity and repair, and healthy, organic, wild caught, grass fed, free range protein. So beef, buffalo, organ meat, fish, wild caught fish. Oh my gosh, love sea bass. And so low carbohydrate and healthy fats, avocado, olive oil. Healthy fats are critical to overall for hormone health as well as mental health. So
couldn't agree more. Guys, we could talk about this forever, but thank you so much, Dr. Cabeca. And for anyone wanting to check us out, just click our profile and click our name, and then we both have links in our profiles that'll take you exactly where you need to go. So thanks for making the time for this morning. Anyone who liked this, I'm going to be posting it on my feed, and please comment below with any other questions that come to mind, and we'll answer you guys. And if you really liked this, we can always do another one that's like a little bit more advanced topics. So have a wonderful rest of your day, and we'll talk soon.
Thank you. Thanks for having me, Christine.
My pleasure.
Bye, everyone.